Welcome to our Honor School's Fall 2023 Research Conference. I am Jennifer Ross, the Acting Dean of the Honor School. It is so nice to see a nice, full, packed house today, because today is one of the biggest days on the Honor School calendar, and it's one of the days that we most looked forward to. And this is essentially our Super Bowl, or our World Cup title game, or a CAA championship game, if you will. It's important to us because this is the culmination of a lot of work and a lot of time and a lot of effort by our Honor School students. I learned the importance of today exactly a year ago. I began my journey at Monmouth University on December 7th, 2022. And I only started that day because Dean Mezzi, a retired Honor School dean who has joined us here today, wanted me to attend last fall's research conference. I had other intentions. I originally wanted to start the following week, give myself a nice week off in between jobs, a luxury that rarely happens, but I took Dean Mezzi's advice, and like many of you in this room who have also taken Dean Mezzi's advice, I was very glad that I did. So on day 3 at Monmouth, I was sitting in the back of this room, and I witnessed my first fall research conference. And I was completely and utterly impressed by the scholarship and the research and the passion and the creativity and the complete breadth of knowledge that our students exhibited with their projects. But that day, it was as if I had flipped to the last chapter of a book and read it. I knew how the Honor School journey ended, but I had no idea how we got here. I've spent that last year reading this entire novel, and I entered today's conference with a much more profound appreciation for what our students have done to get here. And what you have done as undergraduate students is nothing short of impressive. The Honor School thesis is the culmination of the content that our students have engaged with and studied at Monmouth University. The projects that they are presenting today are all their own. They've come up with this topic through coursework and conversations, and for many, this thesis allows them an opportunity to explore an area beyond their curriculum. For others, it allows them to find commonalities between their two majors. For some, it gives them a chance to delve into their degree content in more detail. And for all, it provides a challenge, but it is that, a challenge. Our students spend, at minimum, a year working on this project, and many of our students even choose to extend that timeline so they can delve much deeper into their work. They take a semester in our HO 396 course to find 25 supporting scholarly sources and write a literature review. Today, they're going to talk to you about what they did in HO 496, which is their final class, where they use their research toward something. And that something varies. I've spent a lot of time this year talking with Honor School students, and the honors thesis is the #1 topic of conversation. Even if someone is coming in to ask me about a class they should take or their fall semester schedule, we always find ourselves talking about the honors thesis. And when I talk about it, I find myself using some very vague terminology, because as you'll see today, there's not one right way to do this. Our students are allowed to take their research and use it in a way that most benefits them. In this session today, we are going to learn about chemistry students' experiences with a flipped classroom, the effectiveness of aphasia support groups, the influences of social media on mental health, and why we should have a class in aerospace medicine. As you can see, that's a struggle to kind of summarize in a nutshell. Our students can choose what excites them the most, and that is the fun part of this project. But there's a lot of challenges on their way, and to get here takes a lot of work. At the beginning, it seems a bit daunting. In the middle, there's a lot of self-doubt, and I'm sure our students today at some point have asked themselves, why am I doing this? But you've made it, you've gotten here to the end of the journey, and I hope now when looking back, you could see why and appreciate the work you put in and the value of this experience. Certainly today, I hope you feel a great sense of pride for what you've accomplished. Today is our Super Bowl because today doesn't happen for everybody. Statistically, only 40% of students nationwide who start in an honor school finish in an honor school and graduate from that school. So today, we are experiencing some rarefied air. All of this, though, is not possible without a lot of help, and first and foremost, that comes from our professors. One of the very unique things that our honor school students get to do is they get to work directly, one-on-one, with a professor of their choosing. They use that professor throughout their 396 and 496 courses to help them navigate the research, the proposal, and their project. Our professors share their knowledge and expertise so our students can get the best thesis experience. That is especially true in a group like today The honor school can't do this without the expertise of our professors. My background is in English. I could not help one of you on your project, so we are very fortunate to have wonderful professors who work and help our students. So I thank you very much for your expertise, your willingness to work with our students, and most importantly, your time. We can't have today or what we do in the honor school without you and your support. So can we please take a moment to thank all of our professors. An honor school is only as successful as the support it receives from around the university. We are fortunate that our administrative staff, deans, and faculty support the mission of the honor school. And this is most prevalently seen in our Honors Council, which is made up of professors from across the university who assist the dean and the honor school. Their input and work this year have been vital, and their dedication to honors education has allowed our school to be as successful as it is. This is also a great time to remind our presenters today that you will very soon, on December 18th, be receiving an email from me with an application to apply for the Honors Council Award for Best Thesis. Though there's one person in particular I would also like to thank and recognize, and that is Doris Meyer, the assistant to the dean. She does so much planning for the honor school, a lot of work to keep us moving, and all of today's efforts are her doing. Even more so throughout this past semester, she's been a great help and a vital asset to me and the honor school. So we take a moment to thank Doris. I'm excited to hear about what our presenters will have today. Before we do, a couple housekeeping items. For one, if you haven't done so already, please scan this QR code. This gives you access to our full program, has our full day's agenda. All of the students who are presenting have their name, their titles, their first readers, their abstracts. There are also a couple scattered, I believe, throughout the room as well. Well, great thank you to our sophomore honor school student and resident graphic design artist, Gina Deej, for doing her work in designing our program. I also ask that you take a moment to silence your cell phones. And just a reminder that we do record, so please keep in mind that we have a recording in progress. We'll be posting this to our honor school website. Lastly, every student, when they get up to present, they will be up here for 10 minutes. They have an 8-minute presentation followed by a 2-minute Q&A, so we encourage all of you to ask some questions when they have concluded. And I hope that all of you have a very similar experience to what I had a year ago. This is a very fun day for us, so I will get us moving to our first presenter. Our first presenter is Rachel Soto, who's a health studies major with a concentration in health science. Today she'll be presenting her research that she has done with first reader Dr. Nikita Burrows.
Hello, everyone. Today I'm going to be discussing student experiences with pre-class videos in the flipped general chemistry classroom. So the flipped classroom is a class structure where students watch pre-class videos at home, which prepare them for active learning in class with practice problems and other active learning strategies. The implementation of the flipped classroom has been correlated with increased performance outcomes and reduced cognitive load. Cognitive load theory supports the use of the flipped classroom. Cognitive load suggests that students have a limited number of working memory resources, which get used up over time as they learn new things. There are 3 types of cognitive load. The first is intrinsic cognitive load, which is related to the inherent complexity of the material. Then you have extraneous cognitive load, which is related to outside factors that come in and use up the students' working memory resources that aren't related to the material. And then finally, you have germane load, which is related to connections that students make between past knowledge and the current things that they're learning. In my research study, we sought to investigate 3 main questions. First is, how do students engage with pre-class videos in the flipped classroom? Then we wanted to know how they use these pre-class videos to prepare for class. And finally, we wanted to know what are other important elements and factors that helped contribute to a student's pre-class video experience or reduce cognitive load. To investigate this, my research group and I conducted semi-structured interviews in General Chemistry 1 and 2 classes at Monmouth. Any student who took either of these courses was eligible so long as they were over the age of 18. Participants were gathered on a volunteer basis through email recruiting, and there were 2 approximately 1-hour interviews for each participant. Compensation was provided with Amazon gift cards of about $20 per interview. Participant names and any identifiable data was kept secure in an encrypted file, inaccessible to the professor to avoid bias and coercion. We gathered 10 participants in total, and each interview was audio recorded with informed consent from the participants. Students were asked general questions about their experience with pre-class videos, and then the interviews progressively got more in-depth with questions about cognitive load, meaning intrinsic, germane, and extraneous load. Audio recordings were then transcribed by students and cross-case coded, where the final themes were agreed upon by student researchers. So our experiment yielded 3 main themes. First, the feelings elicited by pre-class videos, then elements increasing extraneous cognitive load, and finally, the elements contributing to, experience, or reduced cognitive load. So our first theme, this is an example coding table where we have the general theme and then the 3 codes of the most prominent feelings that were present. For example, we had feelings of helplessness, frustration, and disconnectedness. An example of frustration would be Leah when she said that she would get frustrated because topics were really confusing and the video instructor would be joking and it was hard for her. Then you have disconnectedness in Caitlin, where she says sometimes she felt disconnected because there was some guy on her screen and she didn't know who he was, and sometimes he would say, "If you're in my class, we'll go over this in person," and it felt disconnected to her. Then our second theme, we have elements increasing extraneous cognitive load. The 2 main elements that we found were poor time management and questions during video stops where students were unable to move on. Leah said, "I feel I should give myself more time to watch them because I watch them late at night and I'd be rushing through them. I'd give myself more time to fully watch and fully understand what I'm learning from the video." And then as for the video stops, Bob said that a big problem with the stops is that when it asked a question, you were unable to reverse or fast forward, so if you were having trouble, you just had to do it. The last theme was elements contributing to experience or reduced cognitive load. The main codes that we had for this were note-taking, self-accountability, preparing for class, using videos for studying, and rewinding when students lost focus. An interesting note was note-taking in Penny. She said she had an ability to make sure she had the right things written down from the videos and to build off of them. Another interesting finding we had was students' self-accountability, like in Shannon, where she said, "I liked that she actually had us answering the questions, and you couldn't continue unless you answered it otherwise she would have acted like she was listening but wasn't actually listening. But since she had to answer questions, it made her listen." We have learned that the extraneous load imposed by some of the difficulties with the videos may be a factor that could affect the cognitive load students are saving by not having to hear content for the first time in class. Students use the pre-class videos as a means to an end rather than as their primary study tool. And one unanticipated and promising finding was the sense of self-accountability coded from students' interviews. This could prompt future research on what drives students in their educational endeavors. The success of preparation with the pre-class videos for class time varies from student to student and could be due to several factors outside the scope of this study. There are several known limitations to this study. The sample size was small with only 10 participants, and we only surveyed students in a flipped classroom with the same instructor each time. Future research could increase the sample size and expand to other flipped classes at Monmouth or even other universities. This study has shown us that pre-class videos may elicit some negative emotions in students when encountering factors that increase their extraneous load. Future research could also investigate how to cultivate the experience to be more positive for students. Another potential future study would be investigating the impact of students' learning styles and personal characteristics on their pre-class video experience. Perhaps quantifying students' grade performance and connecting it to their pre-class video experience could yield interesting results. This all poses questions that I would like everyone here to consider, one in particular, and that is, how important is it to you that learning is an enjoyable and pleasant experience? Thank you. These are my sources. Does anyone have any questions? Sure.
So you mentioned that these videos were used for general chemistry classrooms. I was just wondering if you thought that this kind of technique of learning would be applicable in more complex classrooms for higher level chemistry classes or just higher level science classes in general?
I definitely think so. Actually, one of the things that we found in our research was that students thought that this could be applied in other STEM courses, and I think that it could be really useful in like math courses perhaps, or upper level science courses, not even just chemistry courses. But I think that it's useful to be able to have time to practice in class as opposed to just sitting and listening to the professor talk. You can practice and perhaps retain more information. So I think so. Yes?
Forgive me if this is stated. Is there like a certain entry level where learners are ready for this kind of model? Like, could it be effective like with sixth graders or fourth graders? Or?
That's a good question. I think that one of the big factors is being able to take accountability for your work and being able to be responsible enough to go home and watch a video sitting down at home as opposed to waiting till you come into class. So I feel like there is an entry level, and with the research that I did for the literature review, I found that most of it started in high school, and most of it is centered around higher education. So I feel like once students get into high school, they maybe have more of a sense of responsibility where if a teacher says, okay, watch this video at home, I think that high school students are more capable of doing that than younger students like sixth graders. Yes?
Has this considered the bar to entry of some students might not have the technology to watch these videos at home?
Yes. In my literature review, I investigated how students were sometimes feeling like they didn't have enough time or didn't have a computer at home, and perhaps they had to go to a local library. But in most of the studies, teachers and universities provided some kind of technology for students to use. In the case that they wouldn't have it, and this was the kind of classroom that they were enrolled in, it's likely that they would either have to purchase something to use it or receive accommodations from the school in some kind of way. Yes?
Has the study looked at how the flipped classroom could benefit different learning styles?
Not in this specific study, no. But that is something that I was really interested in, and as I was going, I was like, we should really consider this. And I think that it's something that I actually discussed with Dr. Burrows and might be a potential future study that we do. So I thought it was very interesting as well. Okay, thank you.
I mentioned before some of the challenges. Rachel took on an extra challenge with her project because she had human subjects. She got IRB approval, which is a really fun journey and a very challenging journey. So a really cool opportunity to get to use human subjects and get official approval for it. Our next presenter is Sarah Godbout, a health studies major with a concentration in health science with a minor in communication sciences and disorder. She's also a part of Monmouth's 4+2 speech-language pathology program, and she'll be presenting her research today that she did with first reader, Dr. Eric Raj.
Hi everyone, my research was on the efficacy of aphasia support groups on patients and their families. So for a little bit of background, aphasia is a language disorder that affects an individual's production and or comprehension of speech, and it occurs from damage to the prefrontal cortex of the brain and the left temporal region, which houses the language networks, Broca's and Wernicke's areas. And damage is typically due to stroke or traumatic brain injury. However, stroke is the leading cause of aphasia, as one third of stroke patients do develop aphasia. So the first type of aphasia is Broca's aphasia, and this area is responsible for semantic and syntactic processing, which just means your speech production. So damage to this part of the brain would result in the inability to produce language. However, individuals are still able to comprehend. Communication with these individuals can still occur through writing, sign language, or even slow and slurred speech. However, Wernicke's aphasia is a little bit different. So this area is responsible for phonological decoding and pre-lexical processing, which is your speech comprehension. So damage to this part of the brain would result in severe language comprehension difficulty, as well as some individuals might lose their overall ability to produce intelligible speech. And those with Wernicke's aphasia are known to babble, or they use nonsense words, as they are able to produce speech, but typically the speech does not have meaning to it. So as we know, communication is an essential to daily living. It's how we express our wants and our needs. So frustrations with aphasia tend to have many consequences. These individuals experience a decrease in their quality of life as they can no longer live a life of complete independence. They have increased rates of depression and anxiety. And individuals partake in fewer social activities, as well as they see their friends and families far less than prior to their development of aphasia, and this can all seem to be supported in a 3-year-long longitudinal study. So stemming from this, my hypothesis was that aphasia support groups are an effective way at eliciting a positive emotional response from the individual with aphasia as well as members of their family. And my research was conducted on an observational basis, which allowed for direct viewing of various different aphasia support groups. The first group that I observed was on July 31st of 2023, which was a couples open chat. And then the second group was on August 16th of 2023, and this was a virtual memory/problem-solving aphasia support group. It is also just extremely important to note that my data is primarily subjective. Support group sessions were attended, and then observations were taken from that, but there was never any direct contact between me and the members of the aphasia group. So for time's sake, I'm not going to go into all the details of my observation tables. However, I do just want to point out the important quotes from each session. So for the virtual memory and problem-solving group, one of the speech-language pathologists was stating, like, a few of you have expressed that, which was really showing that she was taking time to hear them, hear their worries, and she wasn't just dismissing their feelings, but rather addressing them as a whole. One member also said, "We got this," which was showing that he was supporting his whole group and he was looking at them as like a community rather than just like individuals with aphasia. And then finally, when one member was getting frustrated with the task at hand, the speech-language pathologist asked him, like, "Do you want to phone a friend?" And he was able to say yes, and I choose and name someone by name, again showing this is a community, they do have friends, it's there, it's not just a bunch of people meeting once a week and then going home. They really do connect with each other. Similarly, for the couple's open chat, one of the spouses was using humor to kind of lighten the mood, and she said like that she oftentimes tells her spouse, "Oh, just spit it out," and it makes them both laugh. And this is very important just because a lot of times humor tends to get lost in these situations, but this was a way that made the whole group laugh. And then another important quote from it was, "We all signed up for the in sickness and in health, but no one told us how to handle the sickness part." And this really showed that individuals in these groups were able to be very vulnerable, kind of let down their walls, and then they were all able to bond because this is something that they all do feel, and then they were also able to gain advice from each other. So the results from these observations, when looking at the memory and problem-solving session, members were very frustrated with the tasks at hand because they were designed to be difficult for them. However, these initial feelings of frustration quickly turned, and members were able to celebrate together. They were very proud of themselves and as a whole group. And then for the couple's open chat, we saw that individuals with aphasia were able to express their irritations not only living with aphasia, but also with their spouses, as some spouses were overcompensating for their lack of conversational skills. We saw new members were able to benefit from talking about their experiences with people who have been dealing with it for a while, and they were able to get advice from that. Members brought up their worries, and this was like kind of a bonding moment because a lot of spouses as well as members with aphasia tended to have the same worries, and then they were kind of able to remedy the situation and give each other advice. And then finally, members did not want to say goodbye at the end of the session. They wanted to continue talking, and they were ready for the week ahead. So to conclude, findings in the study directly support the claim that aphasia support groups are very effective at eliciting positive emotional responses in aphasia patients as well as their families. Both aphasia support groups had members enthusiastically awaiting the week, and it showed that their intense humor also was beneficial for the group, as it was encouraging open communication with the members and enabled conversations to be natural. Research also shows that many individuals with aphasia develop severe depression. However, the support groups are seen to aid in decreasing the probability of a depressive disorder setting in, as therapy has the ability to address the emotions that one might feel living with aphasia. And finally, when combined with speech and language treatment, patients are said to have improved speech, language, and psychosocial outcomes. Finally, I would just like to thank Monmouth University and Dean Ross for allowing me the opportunity to explore this research, and a special thank you to Dr. Raj for supporting my proposal and providing me with great advice and guiding me through the completion of my thesis. Thank you. Does anyone have any questions? Yeah?
These support groups that you observed, did they disseminate based on the Wernicke's or Rothko's?
They didn't, no. So there was a mix of both.
Is there a way they compensated for that?
So I think because there was a mix, it was you could kind of tell who was having more difficulties and who wasn't. And I think, especially in the problem solving in memory, a lot of times, like the speech language pathologist that was working with them would facilitate with them if they were having like extreme difficulties. But in the couples open chat, it was a little bit different because you had your spouse to kind of help you conversate if that was something that you were unable to do. Yeah.
Was it easy for you to find an aphasia support group in the local area, or did you have to travel far to find them?
So I did all mine virtually. So one of them I think was in like New York, but the other one was in California, so there was a big time difference. So like when they were doing it at 6:30, I think I was doing it at like 9:30. Thanks.
Very nice job. One of the other challenges they have is, as you can see, they're very knowledgeable on their topics because they've spent so long on it, but today they only have 8 minutes to talk about all of their knowledge, and that's the last curveball I think we throw at them is today's event. Our next presenter is Alyssa Gordon, who's a nursing major, and she'll be presenting her research that she did with first reader Dr. Patricia Ciccione and second reader Dr. Paulina Amberg.
So good morning, everyone. My name's Alyssa. As Dean Ross said, I'm a nursing major, and I chose to do my thesis on the influences of social media use on adolescent and youth mental health. So I chose the topic because I wanted to address a topic that's relevant to both society and the nursing field. And technology, especially social media, as we all know, is becoming increasingly prevalent. And although it's convenient for daily activities, it does pose adverse effects to users' mental health. And also, mental well-being is an important component of one's overall health, and research shows that medical professionals tend to prioritize patients' medical conditions over mental health when they should ideally be prioritized equally. And so before I go any further, I just want to precisely identify my population of focus, as age groups could often get confusing. So I chose to focus on adolescents and the youth. So in my thesis, adolescence is defined as 10 to 19 years old, and the youth is defined as 15 to 24 years old. And I chose these age groups because they most frequently utilize social media. And it's also important to manage mental health conditions at a young age in order to prevent them from developing or worsening later on in life. So one relevant theory throughout my thesis was the social comparison theory. And this theory suggests that individuals are inclined to compare themselves to others to assess their progress in life. And these individuals jeopardize their mental health when they perceive others to be superior to themselves. And this specifically relates to social media use because people try to impress others on these platforms, and the viewers may identify themselves as being less attractive than those individuals, which negatively influences their mood. So for my creative capstone project, I chose to write a continuing education article for a nursing journal, and I chose to write an article directed toward nurses in order to raise awareness on the significance of the issue and ultimately enhance patient care in the clinical setting. So I chose to direct the article toward nurses as I decided that this would be most effective because nurses would be more likely to read the article and implement it into their practice rather than, say, relying on parents and children to read an article. And so in the next few slides, I'll be outlining the main concepts in my continuing education article that I wrote. So in the introduction, I discussed several reasons as to why clinicians don't prioritize patients' mental health. And this ultimately stems from a possible stigma that they may have toward patients with mental health illnesses. And this can be due to them lacking sufficient knowledge on mental health, as well as them having a potential discriminatory behavior toward patients with mental health issues. And this stigma can impact health-seeking behaviors of patients living with mental health disturbances in which they don't seek the care that they require. The next section of my article discusses the potential impacts of social media, and it ultimately suggests that there's uncertainty regarding the association between social media use and the youth mental well-being, as there's both negative and positive impacts. So one of the main negative impacts is digital stress, which is just when someone feels overwhelmed by receiving excessive notifications and others' judgments. And there's an association between digital stress and increased social media use and depression. However, when social media use is used in a correct manner, there are several positive impacts, which include developing an improved relationship with family, friends, and just feeling more connected with society. And it also could be a method of articulating feelings. And the next section of my article discusses the idea of implementing the nursing process and social media use interventions. And you may not be familiar with this if you're not in the field, but the nursing process is just a standard guide that all nurses use for patient-centered care. And the steps include assessment, diagnosis, planning, implementation, and evaluation. So nurses should utilize a biopsychological approach while assessing the patient, as it helps establish a practical diagnosis and plan. And the nurses may also benefit from using a multidisciplinary team to establish a plan, implement the plan, and evaluate the effectiveness of the plan. So some examples of team members can include a clinical psychologist or a psychiatric social worker. And evidence-based practices are a critical component of nursing, so there are several interventions that the nurses can utilize to address this issue. So one of the things that the nurses could do is asking the patient about their motives behind their social media use, because it enables the patient to openly express how they're feeling about their social media, and it can help the nurse identify any potential issues, such as their feelings deep down or their social media habits. And patient education is also another important component of nursing. And so the nurse can educate the patient on utilizing social media in a positive manner rather than limiting its use altogether, because by limiting the use altogether, the patient may feel threatened and they're most likely going to be more non-compliant. And also, the nurse can educate the parents on the significance of monitoring their child's amount of time spent on social media, as research shows that increased parental control over the amount of time that their child spends on social media is associated with the child spending less time on social media, which ultimately improves their satisfaction levels. And so now I'm going to show you what my actual article looks like. Of course, can't locate it. It's working before.
Escape. And then we click Control, Enter. Oh, that's fun.
That's so weird. So it works when we did.
Doris, Doris, do you have any answers for this? Oh, we're not on the internet. I think that's what it's saying. I didn't read that. We have technical difficulties. Please stay with us. It says
And I'll
connected.
just share, this is really important work because, you know, when healthcare
Yes.
professionals are asking questions to their potential patients, they often will ask, how are you doing? And usually that's in the physical space, right?
Yeah.
And now what you're starting to show is we should be asking how you're doing in the digital space too. Because it's very often that we live in two different worlds, sometimes simultaneously because the phone is attached to us. So really important work.
Thank you. Yeah, and you should be using a holistic approach while you're diagnosing and treating the patient. And mental health is obviously just as important as your physical health, but we tend to prioritize physical health more. So that's kind of what made me choose this. Thank you. Let's see, now we're just waiting for it to load. Sorry about that. It worked before when I did it. I don't know what happened. All right, so here's my article. So the title is The Nurse's Role Promoting Adolescent and Youth Mental Health. And then over here it discusses the introduction. And then here's the potential impacts of social media. And over here are the interventions that I just mentioned. And so over here is just a brief 10-question quiz that the nurse can take upon their reading of the article. And it's not meant to be super challenging. It's just to ensure that they understood what they just read and can effectively implement it into practice. And all the answers could be found directly from the article. And over here just has all the correct answers just to make sure that they know what they're talking about and can apply it correctly. So now I just want to thank you all for listening to my presentation. Does anyone have any questions? Yes.
Was there one social media in particular that had more of a negative impact or adverse effect on mental well-being?
So my research didn't cover specific social media because I wanted to focus more on the mental health aspect and the general just overall effect of it and like how we could change this in our healthcare. But if I go forward with it, so I'll be sure to look more into specific social media platforms. Any other questions? Yes.
So it's more of a comment than a question, Alyssa. I agree with Dean Ross that this is the Super Bowl and not everybody makes it here, but very few nursing students make it here. And because your program is just so packed, it's really hard for nursing students to figure this out and make it work. So I just wanted to commend you on making it to this point as a nursing student, and hope that you incorporate this somehow into your career as well.
Thank you so much. Thank you. Any other questions?
Very well done. Dean Mezzi took the words right out of my mouth. This is an extra challenge for our nursing majors as well. All right. Our final presentation for this session is Haley Brooke Loro. She's a health studies major with a concentration in health science. She will be presenting her research today, having worked with first reader Dr. Jamie Pigman and second reader Dr. Michelle Schupakow.
Hi everyone, my name is Haley and I'm a health sciences major. I did my capstone project on creating a course proposal for an introductory to aerospace medicine course from Monmouth University. Before I begin describing how I created this course idea, I decided to share some background on the importance of the field of aerospace medicine. During my research, I learned that the United States has an agreement called NORAD, which stands for the North American Aerospace Defense Command, which was created in 1958. NORAD essentially watches, warns, and responds to any aerospace threat in the United States and Canada from any foreign invader. However, Operation Noble Eagle was also created after the 9/11 terrorist attacks when the U.S. was attacked on its own ground from the inside. Due to Operation Noble Eagle, airmen now stand on call 24/7 to protect our country from any aviation threat. Essentially, it's important to study and make improvements in the field of aerospace medicine because these pilots must remain healthy in order to fly and must be able to respond in a timely manner to any aviation threat to defend our country. In addition to being able to defend our country through ensuring pilots' health, studying this field of medicine will support the future of space travel and space exploration. So after researching the importance of this field of medicine, I decided to research other institutions that are making advancements in this field. Some of these institutions include Johns Hopkins University, who have done research on astronauts' vestibular function, which is their sense of balance and body position. Mayo Clinic also has a 2-year fellowship for medical students to receive specialty training in the diagnosis, prevention, and treatment of conditions associated with the aerospace environment. Lastly, Cleveland Clinic has collaborated with NASA to develop a new exercise harness for astronauts on the International Space Station and has made an attempt to learn how the spinal muscles of astronauts change in space environments. However, all these institutions are making advancements and conducting lessons at the postgraduate upperclassmen level, and I soon learned that despite the incredible importance of this field, there isn't a university teaching about these conditions at the undergraduate level. By researching the different medical institutions already involved in this field of aerospace medicine, I was led to learn about the International Space Station, which is where a lot of the astronauts that are being studied in these other institutions are traveling to. Most of you may not know that the International Space Station, or the ISS, is the largest single structure ever put into space and travels around the Earth every 90 minutes. On board the ISS, there are many studies being done to improve healthcare conditions here on Earth, including studies on Alzheimer's disease, asthma, cancer, osteoporosis, and much more. In addition, lots of medical research has been done on the astronauts themselves to ensure their health care is maintained in space and upon their return to Earth in hopes that these astronauts will continue their medical research in space and to ensure the future of space travel and space exploration remains. After learning the importance of studying aerospace medicine and the other universities that are making advancements in this field, and learning the history and medical advancements being done on the ISS, I decided to create a course on aerospace medicine for Monmouth University. I began to think about the different medical conditions that should be taught to students and came across the Space Medicine Exploration Medical Conditions List, which is a list of about 80 conditions that could be encountered by pilots or astronauts during their travels. This list was created by the University of Texas Medical Branch, NASA, and the Johnson Space Center, and became the foundation for my course creation project. Some medical conditions that are incorporated into this list and will be explored more in depth during my proposed course includes muscle atrophy, bone demineralization that's similar to osteoporosis and how this may lead to decreased bone density and an increased risk of fractures upon returning to Earth, how radiation impacts the body and its connection to cancer, hearing changes due to changes in gravity, hypoxia, circulation changes and how this impacts eye health, and lastly, the NASA twin studies. In the last part of my course creation project, I developed what's called a master syllabus, which is the syllabus the instructor that's teaching a course refers to throughout the semester. In this master syllabus, I developed a course description to provide a foundation for how I believe this course should run. I included that the purpose of this course is to explore medical conditions, treatment, and preventative measures of pilots and astronauts, as well as be able to provide students with a deeper understanding of different medical conditions that are not commonly taught in depth in other courses. I included that this course should be designed for students with no medical knowledge so that all majors may find this course interesting and will be able to learn something from it. Throughout the course, students will use the research being done at NASA and on the International Space Station to learn all the material at the undergraduate level, which is not being done at any other institution in the US. After creating the course description for the master syllabus, I also had to create multiple course objectives to break down what students in this course will learn. Some of my personal favorites are listed here. One course goal is to learn about the history and objectives of the US Space Force and the US Air Force, and learn about the medical exams pilots in these branches of the military must pass in order to fly. In addition, students will learn some of the conditions that exempt a pilot to fly and why these standards are placed. Students will also learn about the history and main objective of Operation Noble Eagle and will gain an understanding of the importance of ensuring that pilots are healthy. Another course goal is to learn about the results of the year-long NASA twin study of Mark and Scott Kelly from 2015, and we'll also learn about the causes, treatment, and preventative measures of bone demineralization and its connection with muscle atrophy endured by astronauts in space and aviation travel. Before I conclude, by a show of hands, who here would take an aerospace medicine course if it were to be implemented at Monmouth? Thanks. Does anyone have any questions? Yeah?
So if the course was implemented, what prerequisites would you need? What level, what course level would it be? How would...
Good question. I suggested that there shouldn't be any kind of prerequisites because I wanted to encourage anyone with any different majors to come and join. Just that way it's easy to come in, learn something new. And I feel like anything that you learn in this course could be connected to your major, so. Yeah?
What would be your recommendations on how to find someone qualified to teach the course?
I would suggest someone with a health science major, like backgrounds, probably a professor who is already at this institution. I was actually talking to someone this week, one of my health sciences professors, and she said that she was very interested in this course. Yeah.
Why do you think this would be best implemented at the undergraduate level and not when you get to med school or something in that capacity?
Just because some people don't make it to medical school, some people stop at nursing, some people stop at education majors, some people stop at just a regular science bachelor's degree. So I feel like just having this at an undergraduate level would be very different compared to other schools. Yeah.
So, Haley, your other option is that you go and get your master's degree and come back and you teach it.
That'd be awesome. I would like that. All right, thank you.
Wonderful job by our presenters today. An official now, congratulations to all of them. They have finished their honors thesis. You can breathe an official sigh of relief that it is done. We thank all of you for coming today and joining us. We do have some coffee next door should you want some. Feel free to hang out and chat. If you're sticking around for future presentations, our next session is at 11:40, so you have some time to hang out here should you want. Thank you very much.